where we will be providing an update on COVID-19 modeling. My name is Mark Johnson, and I will be the moderator today. Bienvenue à la conférence de presse.
Welcome to this press conference to provide an update on COVID-19 modeling. My name is Mark Johnson, and I will be your moderator today.
Canada's Chief and Deputy Chief Public Health Officers, Drs. Teresa Tam and Howard New. The doctors will be available for questions afterward. Aujourd'hui, nous entendons.
Today, we will hear from Dr. Teresa Tam, the Chief Public Health Officer, and from Dr. New, the Deputy Chief Public Health Officer of Canada. The doctors will be available for questions after.
Question, please press *1 on your phone. Si vous désirez poser une question, veuillez appuyer.
If you'd like to ask a question, please press *2.
Today's briefing is for attribution. Le contenu de la session d'aujourd'hui est pour attribution.
Today's content is for attribution.
Begin. Over to you, Dr. Tam, please.
Thank you very much, and bonjour à tous. Today, we'll provide the latest update on the national epidemiology and modeling work that informs the ongoing management of COVID-19 in Canada. Since the peak of activity in the spring, we've made tremendous progress both in reducing COVID-19 disease activity and increasing vaccine coverage. This has enabled the lifting of many public health restrictions across the country. But as we've seen in recent weeks, that comes with some expected increases in daily case counts. However, with ongoing efforts to increase the proportion of fully vaccinated Canadians and continued vigilance with public health advice, we could keep infection rates lower and reduce the risk of a strong Delta wave that could exceed healthcare capacity in the fall and winter.
Bonjour à toutes et à tous.
Hello, everyone. Today, we will be providing an update on epidemiology and modeling that will help us to manage COVID-19 in Canada. Since the peak of activity in spring, we reduced COVID activity considerably and increased vaccination coverage. This allowed us to lift many public health restrictions across the country. And as we noted in recent weeks, this has led to an expected increase in daily cases. However, we are going to maintain efforts to increase the number of Canadians who are fully vaccinated and can remain vigilant with respect to public health so that we can keep infection rates low and prevent a risk of a COVID wave, which could lead to us exceeding our hospital capacity in the fall and winter.
To slide 1, although case counts are still 93% lower than the peak of the third wave, some resurgence in cases has been observed recently, with an average of over 640 new cases being reported daily over the past 7 days. Fortunately, the number of people experiencing severe and critical illness is still declining. The latest 7-day average for the number of people with COVID-19 being treated in our hospitals each day has fallen below 480 daily. Of these, on average, fewer than 225 were being treated in intensive care units, and there were an average of 8 deaths reported daily. Not surprisingly, the majority of cases, hospitalizations, and fatal outcomes are occurring among unvaccinated people.
Si on avance à diapositive.
If we move on to slide 2, we can see that the provinces and territories have noted a decrease in hospital occupancy rates as infection rates decline since the peak in the summer. This has allowed our healthcare system to start to make up for the lag through non-urgent surgeries, with healthcare workers in many regions in the country still facing permanent pressure, with the average stay being around 2 weeks for those in the hospital because of COVID-19, or perhaps even more for people who are seriously ill. The number of hospitalized people has been increasing over time and causing pressure on our healthcare services.
3. The 7-day moving average for the national RT has been trending above 1 since July the 18th, after many weeks of trending out of an epidemic growth pattern with values below 1. However, with overall lower case counts and fluctuations in reporting frequency across provinces, this RT is somewhat unstable and sensitive to these fluctuations. While most jurisdictions remain out of the epidemic growth pattern, some are showing signs of increased disease activity and RT trending above 1 as restrictions have been eased. This growth is not unexpected, but it will be important to respond to new cases and clusters through testing, case finding, and targeted vaccination efforts to slow the spread. If RT remains persistently above 1 for several weeks, with predominance of the highly contagious Delta variant, we could expect to see a return to rapid epidemic growth, particularly as measures that slow the spread are eased.
Diapositive 4.
Slide 4. With more concerning cases being noted in Canada, case numbers increased in June, and the Delta represents the most of the cases that have been reported. The unvaccinated are the most exposed to the risk of infection, and spread in regions where vaccination is low has seen the emergence of new variants with the Delta variant. We have to remain cautious to reduce the spread, particularly with respect to variants which can escape protection provided by vaccines. It's important to note that full vaccination with 2 doses against COVID-19 offers considerable protection, and that high vaccination coverage within the Canadian population should considerably reduce the possibility of the spread of the Delta variant, while still decreasing the gravity of COVID-19 in the future.
Slide 5. More than 48 million doses of COVID-19 vaccines have been administered across Canada since vaccination began in mid-December, providing an estimated over 81% of the eligible population aged 12 years or older with at least 1 dose of COVID-19 vaccine, and over 66% are fully vaccinated. Covering the last stretch as we shoot for the stars in high coverage, particularly for first doses, we require public health and communities to increase targeted approaches that reduce barriers and provide supports. Everything from more accessible locations and hours to information, language, and cultural outreach resources can make a difference to getting more of the population informed, confident, and protected.
Diapositive 6.
Slide 6. We're going to continue to observe the encouraging progress with respect to vaccination rates in all age groups based on data on vaccine coverage. It continues to increase gradually in all age groups, up to 70% of adolescents and young adults, and up to 75% of people aged 70% or over who have received at least 1 dose. The second dose administration allowed us to increase coverage rapidly in recent weeks. Now, up to 46% of adolescents and young adults, and more than 90% of people aged 70 and over are fully vaccinated. The fact that Canadians continue to get vaccinated has allowed Canada to be amongst the 5% of coverage countries that with the highest vaccination rates in the world. However, the true target is to fully vaccinate the largest number of admissible people as possible so that we can offer strong protection against symptomatic diseases, serious diseases, and new variants, notably the Delta variant. there are still more than 6 million eligible Canadians who are still not vaccinated. And that is why we have to aim for gold with respect to vaccine coverage so that we can protect as many Canadians as possible.
Slide 7. With millions of vaccine doses administered, there have been relatively few cases reported in people who have received at least one dose of COVID-19 vaccine, and fewer still among those who are fully vaccinated. Remember, vaccine takes time to work, needing at least 14 days after the second dose to provide optimal protection. Based on data from 11 provinces and territories for mid-December to July the 12th, only 0.5% of cases were in fully vaccinated people, infected 14 or more days after the second dose. What is most encouraging is that vaccination is proving to be highly protective against severe illness. The data show that 85% of hospitalized COVID-19 cases were unvaccinated, and only 0.7% of hospitalized cases occurring in fully vaccinated patients. Compared to cases in fully vaccinated people, unvaccinated cases were over 3 times more likely to be hospitalized. This aligns well with vaccine effectiveness studies that demonstrate strong protection against severe illness in vaccinated people.
Diapositive width.
Slide 8. The update of forecasts showing the increase, the number of cumulative cases, but not a cumulative increase in deaths. And this is expected in short-term growth, and we see this in the initial trajectory for long-term forecasts.
This updated longer-range forecast shows how the epidemic trajectory may evolve through early September. It suggests that we are at the start of the Delta-driven fourth wave, but that the trajectory will depend on ongoing increase in fully vaccinated coverage and the timing, pace, and extent of reopening. While some resurgence is expected as measures are eased, this updated model shows that if we maintain current levels of community-wide contacts, we would expect to see a modest increase in cases along the dark gray line trajectory. However, if cases increase along the blue line trajectory, it could mean that reopening is proceeding too quickly before enough people have developed immunity through vaccination. And we could expect to see a sharp resurgence by the end of the summer. We expect cases to be concentrated largely in younger, unvaccinated people, with further spread extending into the older, unvaccinated populations. Both higher case volumes and older age of cases could ultimately increase severe illness and hospitalization rates. This forecast reaffirms the need to take a cautious approach to relaxing public health measures, to remain vigilant and responsive to signs of resurgence, and to continue to increase first and second dose vaccine coverage.
Diapositive dis.
Slide 10. As reopening continues, Canada will be able to look at the UK's experience that has high vaccination rates that are similar to ours. In the UK, the trajectory shows that even countries with large vaccination coverage can see a resurgence that is significant and high transmission in young people who are not vaccinated if there is a Delta variant wave. The trajectory in the UK shows that the vaccination does provide protection against COVID-19, where a sharp resurgence in cases did not lead to a marked increase in hospitalizations. This international experience with Delta waves underscores the need to gradually remove restrictions until vaccination coverage is high across the country.
Slide 11. Not unexpectedly and in line with the longer-term forecast, this model shows that a resurgence of cases is likely this fall and winter when restrictive measures and individual precautions are lifted, as indicated by the vertical blue dashed lines. The scenario on the left shows that even with 72% vaccine acceptance in the 18 to 39-year-olds, there is still a risk that healthcare capacity could be exceeded with a Delta-driven wave, even when taking into account the very high fully vaccinated coverage in the older age groups. The good news is that there are still opportunities to reduce this risk. If the proportion of the fully vaccinated 18 to 39-year-olds were to increase to 80%, this could significantly reduce the size and impact of the resurgence, as shown in the scenario on the right.
Diapositive 12.
Slide 12. Canada has made important progress with respect to increasing vaccine coverage in recent months, but we need more people who are eligible to get vaccinated with 2 doses. Roughly 6.3 million people still haven't received their first dose of the vaccine, and more than 5 million people still haven't received their second dose. We have to roll up our sleeves and aim for the highest vaccine coverage possible. The Labor Day period is very important to increase our coverage before we go back to school, colleges and university, and back to work this fall. This means we have to increase our vaccine coverage above 80% in all age groups, and particularly in the younger age group, where most of the transmission of cases is taking place. Today's modelization shows that we have to increase the uptake of first and second dose in young adults, and this can have an important effect with respect to providing better protection for the fall and winter. Thank you.
So slide 12. Canada has made great progress on increasing vaccine coverage over the past month, but we need more eligible people vaccinated. Almost 6.3 million people are not yet vaccinated with the first dose, and these plus over 5 million people have not yet received their second dose. This call for arms is to shoot for the stars in vaccination coverage. With just over 5 weeks until Labor Day in Canada, this time is crucial for building up protection before we gather in schools, colleges, university, and workplaces this fall. This means increasing fully vaccinated coverage above 80% across all age groups, but particularly in younger age groups where most of the transmission is occurring. Today's modeling underscores that increasing first and second dose uptake in young adults can have a big impact in building up better protection for the fall and winter. Thank you. Merci, Miigwech.
Merci, Dr. Tam and Dr. New. Thank you. We will now open the phone line to questions. We ask that you limit yourself to 1 question and 1 follow-up. We will be taking your questions in both official languages. Nous allons prendre des questions. Nous vous demandons de vous limiter à 1 question et 1 question de suivi. Vous pouvez poser vos questions dans l'une des 2 langues officielles. Operator, first question. Operateur, première question, s'il vous plaît.
Thank you, merci. You may press star 1 if you have a question. Vous pouvez appuyer sur étoile 1 si vous avez une question. The first question is from Mike LeCouture from Global News. Please go ahead.
Good morning, doctors. Thank you very much for doing this. I wanted to ask you, especially given what you presented today and seeing that Alberta has announced its ending pandemic response plan, the reducing testing and contact tracing, no longer really requiring positive COVID cases or close contacts to quarantine. Do you think that this is a safe policy given the spread that we're seeing right now of the Delta variant? And I wanted to know what your concerns are about Alberta's decision and whether or not they could have a national impact as people are traveling during these summer months.
Yeah, thank you for the question. And of course, we're in close touch with provinces and territories, including Alberta. And I think our role is, of course, to develop guidance, and it's up to the provinces to execute their own responsibilities and mandates. I'm seeing that Alberta is moving away from mandated approaches towards more individuals taking up responsibility and following best practices in terms of reducing the risk. Of course, I firmly believe that quarantine and isolation can help prevent the spread of COVID-19, especially in light of the spread of the Delta variant. And I believe Alberta is going to strongly recommend to cases to isolate. And absolutely, if the policy in Alberta is not to mandate that, then I would ask that any individual who is diagnosed with COVID-19 or you think you may have it, please isolate, please get your test, and inform your close contacts. And I think Alberta is not like all provinces are doing very well in trying to get their population vaccinated, but still has a ways to go. With say 75% first dose, you still have the hundreds of thousands of people not vaccinated can lead to pretty big potential for large clusters, outbreaks, and an escalation in the epidemic itself. So, of course, we advise prudence and caution. I think the members of the public have got used to individual protection and wearing masks, respecting physical distance, avoiding really crowded enclosed spaces, ensuring ventilation is maintained and stepped up. Some of the still critical measures, but the bottom line is get vaccinated. There's still a ways to go in Alberta, and that's really important to do.
It's Dr. Newman. I would just add a couple of points to what Dr. Tam has obviously given in a very comprehensive answer, is that, yes, we recognize we have a federated system of government here in Canada with the individual provinces and territories having responsibility for the delivery of both healthcare and public health services. But certainly at the national level, we have very close collaboration. We have regular meetings with our counterparts in the provinces and territories. We exchange information, scientific and otherwise, learn from each other's experience. But I think your last point about the travel and so on, yes, certainly I think everyone is alive to the fact that there could be, as you say, knock-on effects to the other provinces and territories with travel within Canada, with residents of one province going to another province. Obviously, in this case, we're looking at Alberta. So that's something that's, I think, a bit of a live issue. The other provinces and territories will need to do and recognize what in their context might be most appropriate for their residents and to protect their public health and healthcare systems within their own provinces. So that work continues. Thank you.
Maybe just a reality check that Delta is going to be in every jurisdiction. And in addition to any kind of concerns about domestic travel, it's really Delta can be anywhere in Canada. So it's not just about domestic travel or spread. That's a very real reality. I mean, Ontario, for example, already have the mass majority of the new cases are Delta. So it's not just about the fact that Alberta may have a Delta-driven wave, or the others may well get in a similar position if the vaccinations, the vaccine rate going up is not as fast as the relaxation of measures.
And just as a follow-up, I wanted to ask you, today's press conference is largely concentrated on making sure we get first and second doses into arms. We're now seeing that Israel is one of the first countries to offer a third dose of the vaccine to its citizens on a wide scale. Given the concerning rise in Delta, is that something that Canada should be considering as well for people who already have their second dose? Should we be looking at starting to hand out a third dose?
Well, I think there's a lot of evolving data in this space, and the National Advisory Committee on Immunization is very much looking at the evolving information. Right now, there's not enough data to suggest that in Canada, we would go into boosting as yet, but it is something that we're watching very carefully. The breakthrough infections are very few at this point. We're not seeing those breakthroughs occurring in the initially vaccinated populations as yet, but we're very much attuned to the potential for a need for booster, and we're getting operationally ready, whether it is looking at supplies, whether it's looking at the implementation side. The provinces are looking at, well, what if we did need one? How would we implement that? But we've got to get those first and second doses in for sure. That's got to be the priority. But we will, of course, be updating everyone should there be a change in the advice for boosters. We're very much alive to, the company like Pfizer submitting information and data that needs to be examined. But I'm also conscious of the fact that some of the data still suggests very good vaccine effectiveness at, say, the 6-month stage. But of course, that might be without taking into account the Delta variant, which is evolving. So there's a lot of moving parts. But at the moment, I think people should be very heartened by the fact that the breakthrough infections are very few.
Thank you. Next question, please. Prochaine question.
La prochaine question est de Boris Proulx, Le Devoir. La parole est à vous.
Bonjour.
Question from the Devoir. My question is about slide 8. The increase in the number of cases in the worst case scenario may see an increase in August, but it won't be followed by an increase in the number of deaths, if I understand correctly. Can you explain why the deaths would not follow, and if it's still as serious if there aren't a lot of deaths?
Merci pour la question.
Answer. Thank you for your question from Dr. New. That is a good question. It's something that we know. The situation is very different now than it was perhaps during the first, second, and third waves, because now we do have vaccines. They're very important. We really think that vaccinations have been effective in all contexts. And with the data that we presented today, we have seen that the percentage shows that there's a number that are fully vaccinated. And what we've seen, there's a direct link between the incidence of cases of COVID-19 and serious cases of the disease and hospitalizations and deaths. So this is very good news. And it's very important for everyone to receive their first and second doses to protect themselves from the variants. And that's exactly what we're seeing. It's not the same as before, because with vaccines, we have seen good results, and we hope to continue with the highest vaccination coverage. And that is why we've already seen the impact in a positive way, and we're going to continue our efforts to vaccinate as many Canadians as possible and as quickly as possible. Thank you. Follow-up question. I understood your message. We can't expect to see as many deaths and serious consequences as during the first, second, and third waves. But does this mean that even if there was a fourth wave, as the modeling suggests, PHAC, would it not recommend important health measures, considerable health measures in that case? Answer. It's important because we're making efforts now to continue our vaccination programs, but we also know that with the spread of the variants, and notably the Delta variant, we can't really soften public health measures too quickly. Also, there are some people in Canada who are under-vaccinated, possibly. So there always could be breakthrough infections. So we have to pursue our efforts to vaccinate Canadians and take public health measures across the population and look at individual protection. Always looking at what the epidemiology is locally, because that's always what guides us. When you're in a region that's not very affected, public health authorities can loosen practices perhaps more quickly compared to other regions where there are higher rates of infection. Because it's also linked to vaccine coverage. So overall, it's very important to continue with our vaccination programs, and we can also loosen public health measures cautiously and looking at the local situation on the ground at epidemiological data. I hope I've answered your question properly. I'll stop there. If you have no other questions, thank you.
Merci beaucoup. Operator, prochaine question, s'il vous plaît. Next question, please.
The next question is from Marika Walsh from the Globe and Mail. Please go ahead.
Good morning, doctors. Thanks for taking my questions. I have a few that I hope you can help me with. Slide 11 no longer gives any clarity on what the overall vaccination coverage target is. In the last update, it was 83% full vaccination coverage for all eligible people. Can you please tell me if that is still the target that Canada has, or as many other experts are saying, does that target need to be higher to avoid hospital capacity being exceeded? For example, some are saying 90% is what's needed among eligible people.
Mm-hmm. Yeah, and as you can imagine, capacity is different right across Canada. This is a national estimate in terms of red line. But as I was trying to explain, there's a lot to take in on this slide. The slide on the right, where there's only very few scenarios that would touch the sort of red dotted line. That's with the 80% coverage, including in those 18 to 39 years of age. We know already that the older populations have already reached that target. But if you supplement the great coverage that we've already achieved in those older age groups with a 80% coverage in the 18 to 39 years of age, you will then, the outcome is that you are very unlikely to exceed hospital capacity.
Okay, thank you for that. Can you explain then why slide 9's assumptions in the annex show that even if the assumptions are based on 90% of eligible people having their first shot and 85% of eligible people being fully vaccinated, and even with those assumptions, it shows the case counts exceeding the third wave from the spring. So are we not already on track then to exceed the third wave if we don't yet have the vaccination coverage of 90% first doses that this slide is talking about?
Mm-hmm. Yeah, there's a lot of different assumptions. So what the modelers try to do is model the real data as we go along. So when they observed that some of the age groups had hit 90% and other, another slide that showed the different spreads of vaccine coverage across different age groups, those models adjusted, as well as vaccine acceptance information from the younger age groups, where we think they would be heading and what kind of vaccine acceptance we need to avoid an inundation of the hospitals. So one slide is talking about cases and the other one hospitalization. And Dr. New, I think, was just trying to explain in the preceding answer that given the how effective vaccines are against severe outcomes, the cases may still go up, without a concomitant massive increase in the severity indicators such as hospitalizations and deaths. So we're looking at different outcomes, if you like, in each of these models. Does that help? I'm not sure if I answered your question. One is about cases going up. The other one is about whether hospital capacity will be exceeded.
It's Dr. New. Maybe I could just add.
I do understand that. I'm trying to understand what the actual target is now that Canada is trying to reach with vaccinations. Is the target 80%? Is it 83%, which is what it was said in June? Or is it 90%?
Well, I think it depends on what your final objective is. If it's not to inundate the hospital and reduce severe outcomes, we're saying above 80. So 83 is a very granular number, but for sure we can get there because we know that right now the first dose coverage of the eligible is about 81%. So I think that is perfectly reasonable. But I think we should go as high as possible. Whether you can get to kind of coverage that I think as high as possible is great. When you increase the baseline immunity or community immunity in the population, you're going to really help reduce severe outcomes. But certainly above 80, if we can get to 90, I'll be, hopping over the champagne for sure.
It's Dr. New. Maybe I can just add a few points, I think, to your question, Marika, because as Dr. Tam said, the slide 9 that you're referring to looks at projections in terms of cases. But what we're seeing more and more, and it's certainly the experience in the UK and other countries with high vaccination coverage rates, is sort of a bit of a disconnection, I would say, between sort of case counts and sort of the severe outcomes being hospitalizations and deaths. And the other assumption that you see on this slide 9, which obviously is trying to put a lot of complex assumptions and modeling data into a sort of a simplified slide. As you can see there, it also talks about the number of contacts between people. So that's another important element. So regardless of the vaccination coverage rate, we know that the vaccines are very effective, but there's no vaccine that's 100% effective. And the fact is that even fully vaccinated people, it's still possible that a small percentage of them could pass on the transmission to others. So the sort of the number of social contacts that each individual also has in their social circles and so on is very important to consider. So I think it gets into other areas. So of course, trying to get as high a vaccination coverage rate as possible is very important. But I think people also need to appreciate that what they feel comfortable in terms of their own risk assessment, what they do in terms of how many people they socialize with, even if they're vaccinated. Some people may still feel comfortable wanting to wear a mask, even if it may not be mandated, etc. So all of those things together are part of the mix. But you can see, yes, that's certainly the factor of the number of contacts alone. If that's also modeled in or put as something to be considered, you could see that, quote, it could lead to an increase in the number of cases that we get. But then, of course, as you say with the other slides, then the actual sort of outcomes, what is the impact on the healthcare system, that is in many ways related to the high coverage rate that we're trying to achieve with our vaccination. So hopefully that helps as well. Thank you.
Thank you very much. We'll go to the next question. Operateur, prochaine question, s'il vous plaît.
La prochaine question de Pierre Saint-Arnaud, La Presse canadienne. La parole est à vous.
Question from La Presse canadienne. Hello, Dr. New. I'm curious to know, in the cases of hospitalization, do we have data that talks about previous conditions? The question has been asked several times as to whether people have no previous conditions or pre-existing conditions, if they are more vulnerable to people who do not have pre-existing conditions. Do we have any data about that? Answer. That's a good question. Thank you very much for asking it. In general, we know that in principle, people who have pre-existing conditions are more at risk for serious illness. And I'm almost sure in the provinces and territories, we do have more detailed data. But federally, It's trickier to have all the data, but this is something we continue to watch with our provincial and territorial counterparts. After, we may see if we have something to give you, but for the time being, I know that yes, in every province and territory, we are collecting evidence and data with respect to pre-existing condition for cases in hospitals and in intensive care. This is something that we could underscore if we do have detailed data for the entire country. That is something we could perhaps present in the future, but for the time being, I think we do not have enough details like this. Thank you.
Tam, est-ce que vous avez quelque chose d'autre?
Anything else to add? No, thank you.
En sous-question,
Follow-up question. And generally, we don't have documented cases through contact. That doesn't mean that it doesn't exist. Do we know if there's still a risk? I know, for the sake of caution, people wash their hands. But do we know if the virus can be transmitted other than through the air? Thank you for your question. The science continues to evolve. What I have seen, and perhaps Dr. Tam could add to that, there are several ways to transmit the virus, and we also think it's very important to continue to offer another layer of protection. We have to continue to wash our hands. But with the data to date, we've seen that the most common mode of transmission is from one person to another through aerosols in the air. That doesn't mean that it's not a good practice to protect yourself and others, other germs, to continue proper hygiene and decontaminating services as well. With COVID-19, though, we've seen that most of the cases are really transmitted from one person to another in the air. Thank you.
Merci. Allons à la prochaine question. Operator, next question, please.
The next question is from Jennifer Yang from the Toronto Star. Please go ahead.
Hi, thanks for taking my question. Last night, the Washington Post reported on some new information from the CDC, which I believe will be releasing some more data today as well. But essentially, they're finding new data that suggests viral loads in vaccinated people who have been infected are comparable to the viral loads that were detected in unvaccinated people in a large outbreak in Massachusetts. I was wondering if you've seen this data, if you've reviewed it, and what your reactions are to these findings.
Thank you for the question. I haven't actually seen the data, but like yourself, we've heard about some of the findings, and I'll be very interested in that. I think Delta is a formidable foe. We've known that. Just how formidable it is still sort of evolving in knowledge. So I think we look forward to the data in terms of further contribution to our knowledge. But I think what I heard is we knew the Delta variant is very transmissible, is the most transmissible variant. And I believe that data is going to show that it may be even more transmissible than we originally thought based on the information from the United Kingdom. But some of these studies are difficult to do, so it would be interesting to actually go through the information once we see it published. The other concept is, do vaccinated people transmit the virus? I think is the bottom line. Of course, vaccination is still really important. It's the number one thing people should go out and do. Once you're vaccinated, is it possible? The breakthrough infections are still very few. So the chances of you getting infected is probably lower, and certainly the severe outcomes. But what if you're asymptomatic, you're vaccinated, but you are multiplying the virus in your nose? Could you pass it on to others? I think is the ultimate question, and that the data might show. What does it actually mean then? It means that in those indoor settings, even if you've been vaccinated, maybe people should continue to wear a mask. Certainly when there's still a lot of unvaccinated people around, you don't want to spread it to others, even if you've been vaccinated. I do think some of the previous studies, which were limited in household transmission studies, shows if you're vaccinated, you may reduce transmission by, say, 50%, even though you yourself are protected. The US data may show something different. There's also they have other data. I think they have lots of data that may be coming out, which might show that there's a higher viral load, as you've said. A higher viral load in one's back of your nose, etc., can well then result in an increased risk of transmission in others, even if you've generated enough immunity in the body to prevent yourself from getting sick. So I think that's an evolving space, but we know what works. We know what works for COVID-19. So continue masking, distancing, and as much as possible, particularly obviously if you're at risk, high risk of severe outcomes. If you're any enclosed setting, bigger settings, the 3 Cs, all of those things still apply, and they will help.
I'm wondering though,
and get vaccinated.
Yeah. But I am wondering how much it changes the game if this data is validated that vaccinated people, when infected, can transmit just as effectively as unvaccinated people. You know, what does that, imply for vaccination targets, for pandemic control measures going forward? And, the models you presented today, I wonder how much they would change if this data is to be verified and validated.
Yeah, so a highly transmissible virus and even higher estimations on transmissibility means you do have to reach higher targets to reduce those chains of transmission. That's the bottom line. Which so absolutely. I mean, people have thrown out different numbers. People are trying to estimate how much vaccination, but how much underlying infection there's already in the community also, helps you adjust what vaccination target should be. Compare to the United Kingdom, for example, I don't think Canada has had as much of immunity from infection itself, which means we should strive for as high as possible. I mean, there's many areas of Canada that haven't seen much infection. So for those areas, as I say, shoot for everybody. That's what you really should be shooting for in order to just minimize risk. So is it not about completely breaking down all chains of transmission anymore? We absolutely are trying to keep things manageable so that the serious outcomes are very much minimized. And we still see really effective, really great vaccine effectiveness against severe outcomes. As I said before, we will monitor to see if there is any need for boosters. But I think we're in a slightly precarious period at the moment in between these people trying to get the vaccines in and reopening. As soon as that balance is tipped, and it wouldn't take very much with a highly transmissible virus, you're going to see an uptick in cases.
Yeah. As Dr. Tam and I said, even with our presentation today, obviously there's over 5 million people who are obviously eligible to get vaccine that haven't received their second dose, right? So they've gotten their first dose. So hopefully it's just a matter of that they're waiting for their appointment or whatever, and hopefully they'll obviously go forward to get their second dose. But I guess what we want to also focus on is that why are there 6.3 million, Canadians who are eligible to get a vaccine haven't even received their first dose. What are you waiting for? With all the data that we're showing now, Delta variant, and you're just mentioning with the CDC and their studies about how transmissible it is, and even vaccinated people can carry the virus and then transmit to others. Yes, that's all very concerning. I would say that those who are vaccinated and transmit, they're protected themselves, but obviously it can pass it on to those who are not vaccinated, and it's those people who are really at risk of getting serious outcomes. I was looking at some of the be it reports, be it anecdotes, in some of the U.S. states in the South where I think the vaccination rates aren't that low, and you can see it. Young people, children, being admitted to hospital, being in sort of intensive care, and that's so sad. In my view, this is all very preventable if people go for and get vaccinated. So let's go for it. Let's go.
Thank you. Merci. Allons à la dernière question. This will have to be the last question. Operator, please.
La prochaine question de Anne-Caroline Desplanques, Le Journal de Montréal. La parole est à vous.
Journal de Montréal, question. Hello, thank you for taking my question. I see that the modeling shows that children aren't under the age of 12 will not be vaccinated for the back-to-school period. And do we have forecasts for children in terms of the number of cases? And what would your recommendations be for them? For schools, should they be wearing masks? What would you say? Answer. Thank you for your question. This is Dr. New. Yes, with our counterparts in the provinces and territories, we are planning for the back-to-school period. And what I can tell you, we're waiting impatiently for the results of clinical trials for the vaccine for children under the age of 12. And I can't give you a date. Our colleagues at Health Canada have to review all the data and the evidence to make sure that the vaccine is safe and effective for children under the age of 12, perhaps before they give approval. But when it is approved, we know that our advisory committee on immunization will also review the data and before it gives its recommendation. So it's hard right now to tell you what will happen in the future for September. But we're continuing our work with all the sectors and people involved to plan for the back-to-school period that is safe for everyone. Thank you. Follow-up question. Do you expect an increase in the number of cases in children under 12 with the Delta variant? Answer. Yes, of course. We did note with the spread of the Delta variant, and most of the cases noted have, or 70% or more, are nationally of the Delta variant. So, of course, we can expect other cases in children going back to school because, of course, they can be infected with the virus. But what is perhaps encouraging is that young children, based on experience to date, don't really suffer from very serious consequences or symptoms when they're infected. That's an important aspect because they can transmit the virus to others, such as adults, who may be more susceptible to serious consequences. That is why we continue to encourage everyone who is eligible to get vaccinated with both doses so that we can have full vaccination. And we're also waiting to see what might happen for vaccine approval for young children. But yes, we are waiting, do expect to see cases rather in children when they go back to school. It's part of our planning with respect to administrations in all provinces and territories. We have to manage cases. We have to see what we could do perhaps to protect ourselves and prevent any outbreaks as things go along. But of course, It's a very important component of our work in terms of ongoing management of COVID-19. Thank you.
Merci. Thank you. This concludes today's press conference. Thank you for your participation. Any additional questions can be directed to Media Relations at the Public Health Agency of Canada. La conférence de presse est maintenant terminée. On vous remercie de votre participation. Si vous avez d'autres questions, n'hésitez pas à communiquer avec le Bureau des relations avec les médias à l'Agence de la santé publique du Canada. Merci et bonne journée. Thank you and have a nice day.